Hey guys, good afternoon. Let's begin our ninth session. Let's enjoy the chest radiographs with Dr. Y. Session 9, Congestive Heart Failure. Before starting the session 9, let's review the session 8. What do we see with this film? Yes, ground glass opacity, haziness, bilateral, almost symmetric haziness, more dominant on the lower side than upper side. Yes, this is the usual findings of COVID-19 pneumonia. This is the another case of COVID-19 pneumonia. How about the findings? Almost same as before. This is the CT findings. Bilateral, almost symmetric, subpleural dominant, ground glass opacity or consolidation. Now let's begin our new topic. It is about congestive heart failure. Congestive heart failure is a syndrome, a group of signs and symptoms caused by an impairment of the heart's blood pumping function. Congestive heart failure's radiologic findings are like these. This is the older woman's frontal erect chest PA. First, cardiomegaly. Heart is enlarged, CT ratio more than 50%. And second, vascular redistribution. Upper lower blood diversion. That means upper lower blood flow, blood vascular vessels are enlarged. We also call it cephalization. And C, Curly's B line. And D, cuffing around the bronchi. That means perivascular, peribronchial walls are not clear, fuzzy, with a thickening. And E, interstitial edema. Everywhere interstitial edema. And lastly, pleural effusion. Once, the Irish doctor Curly named several lines from A, B to C. First, A lines, from highlight to the periphery, usually diagonal pattern and long. B lines, short parallel at the periphery, especially CP angle area. Actually, it is the thickening of interlobular septum. C lines are all throughout the lung, short, fine lenticular lines. But most importantly, B lines are important. We don't have to pay much attention to the A and C lines. Let's look at the B lines here and on the left side here. Let's magnify and more focus on the curly B lines. Yes, it's usually on the CP angle area. It is in the periphery, transverse, 1 to 2 centimeter length. Yes, actually that's the anatomy of interlobular septum thickening. Curly's B line. Let's compare with congestive heart failure and normal findings. We do remember this film, this image from the beginning of our session 1. Normal finding is without abnormal findings, and abnormal findings is without normal findings. Let's compare from this side. What do we have not here in the normal man? Heart size is normal, not increased. No Curly's B lines. No cuffing around the vascular margin, bronchial margin. No redistribution of the flow. No pleural effusion. Yes, these are the differences between congestive heart failure and normal chest radiograph. The causes of congestive heart failure. There are many causes. Actually, common causes include coronary artery disease, including a previous myocardial infarction, high blood pressure, atrial fibrillation, valvular heart disease, excess alcohol use, infection, and cardiomyopathy of unknown cause. Let's look at closely this image, this film. What do we see? Endotracheal tube, sternotomy, aortic nerve calcification, many lines of EKG, etc. Central line here. Yes, congestive heart failure patient is apt to be AP supine film rather than frontal erection film, and old people rather than young person, with poor consciousness, with poor breath hold for filming, and more apt to move with motion artifact. So the film is apt to be poor image quality, like this. Let's look first this film. What is your diagnosis about this image? There's an anecdote between cardiologist and pulmonologist. First, cardiologist came and watched this film and then said to the others, "Hey guys, this patient must have been heart failure." And he went. And then the pulmonologist came in and after review of the film, and he also says, "Hey guys, this patient must have a pneumonia." They have their jobs. This is interesting. So we, the radiologist, should show them which direction, which way to go. Let's enjoy a couple of images about congestive heart failures. Just enjoy and try to find out what findings do these people have. First case. Yes, big, accentuated monofish, curly speed lines. Yes, that's true. Congestive heart failure. The CT image shows cardiomegaly and bilateral pleural effusion, many curly speed septal lines, and ground glass opacity of alveolar edema, septal line of interstitial edema, ground glass opacity, many septal lines. How about this patient? Same disease, same pattern. Big heart, cephalization, peribronchial cuffing, curly B lines, interstitial edema, and small pleural effusion. Correct. Let's confirm with these CT axial images. Peribronchial cuffing on CT is bronchial wall thickening, septal lines, pleural effusion in the fissure, pleural effusion. Yes, correct. Congestive heart failure. This is just CT imaging of acute myocardial infarction patient. What do we see? Yes, Heart is enlarged. Many septal thickening. And baratra, small pleural effusion. Yes, congestive heart failure. Session 9 is over now. We finished congestive heart failure. Let's just have an intermission about the quiz of last time. What will happen next after this status? Okay. Total left lung collapse, obscuration of left hemidiaphragm, and elevation and left-sided deviation of heart and mediastinum, total haziness on the left side. And the tracheal tube tip is still in the right main bronchus or bronchus intermedius. Yes, total lung collapse on the left side. Congratulations. This is the quiz for the next session, session 10. What is the name of that arrow? Like, subscribe will be a big support to me. Thank you very much.